The Hallmarks of Cancer, a deep dive into oncology's fundamental framework. Welcome to today's episode, where we delve into one of the most influential concepts in modern oncology, the hallmarks of cancer. Pioneered by researchers Douglas Hanahan and Robert Weinberg, this framework describes the essential biological capabilities that cells acquire as they evolve from normal to cancerous and, ultimately, malignant states. Over the years, this model has been refined from its original 6 hallmarks introduced in the year 2000, expanding to 8 core hallmarks and 2 enabling characteristics in 2011, with further additions in 2022. Our discussion today will navigate through both the core and updated hallmarks, highlighting how these principles shape contemporary cancer therapies. Introduction to the hallmarks. Rather than defining cancer by the organ in which it arises, such as the breast, lung, or colon, the hallmarks of cancer provide a universal language for understanding its underlying biology. This perspective has unlocked new possibilities, enabling the development of targeted treatments that address specific cancer mechanisms across various types. The core hallmarks, foundations and expanded insights. Sustaining proliferative signaling. Cancer cells are notorious for producing their own growth signals, freeing themselves from reliance on the body's regulatory cues. They achieve this by manufacturing their own growth factors, amplifying the receptors needed to respond to these signals, or permanently activating the pathways that drive cell division, such as the RAS and MAP kinase pathways. Interventions in this area include monoclonal antibodies, which block the activation of specific growth factor receptors, as seen in the treatment of certain breast cancers with drugs like trastuzumab, that target the human epidermal growth factor receptor 2. Additionally, small molecule inhibitors, known as tyrosine kinase inhibitors, penetrate cancer cells to disrupt internal signaling enzymes. Notable examples include erlotinib and gefitinib for lung cancer, and imatinib for chronic myeloid leukemia. Evading growth suppressors in healthy tissues. Growth suppressor genes such as p53 and retinoblastoma protein act as brakes, preventing unchecked cell proliferation. Cancer cells, however, disable these protective measures, often through genetic mutations, allowing relentless division. Therapies that focus on this hallmark include inhibitors of cyclin-dependent kinases 4 and 6, which help reactivate the retinoblastoma pathway. Drugs like palbociclib, ribociclib, and abemaciclib are employed in hormone receptor-positive breast cancer. There are also experimental treatments aimed at restoring the function of the p53 protein, such as eprinetipopt, which is currently undergoing clinical trials. Resisting cell death under normal circumstances. Cells with significant DNA damage undergo programmed cell death, known as apoptosis. Cancer cells, however, evade this fate by increasing the levels of anti-apoptotic proteins like BCL2, or by reducing the presence of proteins that promote cell death. To counteract this, treatments such as venetoclax are designed to mimic pro-apoptotic signals and inhibit BCL2, effectively prompting cancer cells to self-destruct. Another approach involves proteasome inhibitors, such as bortezomib, which disrupt the cell's waste disposal system, leading to the accumulation of toxic proteins and eventual cell death. These strategies are particularly effective in certain types of leukemia and multiple myeloma, enabling replicative immortality. Normal cells are limited in the number of times they can divide due to the gradual shortening of chromosome protective caps, known as telomeres. Cancer cells overcome this barrier by activating the enzyme telomerase, which restores telomere length and permits unlimited replication. Efforts to develop telomerase inhibitors, such as imetelstat, are ongoing, with several agents currently in clinical trials aiming to directly block this enzyme's activity. Inducing angiogenesis. For a tumor to thrive and expand, it must establish its own blood supply. Cancer cells secrete signals, including vascular endothelial growth factor, that stimulate the formation of new blood vessels towards the tumor, delivering essential oxygen and nutrients. Anti-angiogenic therapies, such as bevacizumab, work by targeting and neutralizing these signals. Many tyrosine kinase inhibitors, including sunitinib and pazopanib, also possess activities that interfere with blood vessel growth, and are used in the treatment of kidney cancer and sarcomas. Activating invasion and metastasis. The ability of cancer cells to invade neighboring tissues and spread to distant organs is what makes the disease life-threatening. These cells acquire tools to break away from the primary tumor, migrate through surrounding tissue, enter the bloodstream, and establish new colonies elsewhere. Adjuvant therapies, such as chemotherapy, Hormone therapy, or targeted treatments administered after surgical removal of a tumor, are designed to eliminate microscopic metastatic cells before they can become dangerous. Research is also underway to develop drugs that block specific steps in the invasion process, though progress has been challenging. Next-generation hallmarks deregulating cellular metabolism. Cancer cells reprogram their metabolic pathways to support rapid growth. One prominent example is the Warburg effect, where cancer cells consume large amounts of glucose and convert it primarily to lactate, even when oxygen is available. This strategy, though inefficient, provides quick energy and vital building blocks for fast proliferation. Investigational therapies are being designed to inhibit key enzymes in these altered metabolic processes. For instance, drugs like ivosidenib target isocitrate dehydrogenase mutations in acute myeloid leukemia, avoiding immune destruction under normal conditions. The immune system identifies and eliminates abnormal cells. Cancer cells, however, develop sophisticated means to evade this surveillance or even turn off immune attacks by exploiting natural checkpoint signals. Immunotherapy has revolutionized cancer treatment. Immune checkpoint inhibitors, such as pembrolizumab, nivolumab, and ipilimumab, block the proteins that restrict immune responses, allowing the body's immune cells to target cancer effectively. Another innovative technique is chimeric antigen receptor T-cell therapy, where a patient's own T-cells are genetically engineered to recognize and attack cancer cells, offering hope in certain leukemias and lymphomas. Enabling characteristics. These are processes that, while not defining hallmarks, are crucial in facilitating the core capabilities of cancer cells. Genome instability and mutation. Cancer cells often display elevated rates of mutation, which hastens the acquisition of hallmarks. This instability is frequently the result of defects in DNA repair mechanisms, such as mutations in breast cancer gene 1 or 2. Therapies like poly-ADP ribose polymerase inhibitors exploit these repair deficiencies. For example, olaparib and talazoparib are designed to block alternative DNA repair pathways, leading to catastrophic genetic damage and cancer cell death, a phenomenon known as synthetic lethality. Tumor-promoting inflammation. Ironically, immune cells that infiltrate tumors may, instead of fighting the disease, release signals and chemicals that support the cancer's growth, survival, and ability to invade new tissues. Long-term use of nonsteroidal anti-inflammatory drugs, such as aspirin, has demonstrated a reduced risk of developing certain cancers, likely due to their anti-inflammatory effects. Many traditional therapies, including chemotherapy and radiation, can also alter these pro-tumor immune responses. Conclusion. The Hallmarks of Cancer framework offers a comprehensive blueprint for understanding the complex nature of cancer. Modern oncology is shifting away from generic chemotherapy towards precision medicine, using molecular diagnostics to identify which hallmarks are active in each individual's tumor, and then applying a combination of targeted therapies, immunotherapies, and established treatments. This approach promises more effective and less toxic cancer care, representing a hopeful frontier for patients and practitioners alike. Thank you for joining us in this deep dive. Stay tuned for more episodes where we continue to explore the cutting edge of cancer science and patient care. It's the Everything Surgery Podcast. Dissect the extraordinary.